Hello warriors, I'm Kelly and this is my channel Incredible Anyway, where I talk about how to live an incredible life no matter what your circumstances are. And I'm going to be talking about my vestibular nerve section, my brain surgery for Meniere's disease that I have upcoming. And I wanted to tell you guys a little bit about what's going to happen in the brain surgery. What I'm going to be sharing about what's going on in my surgery is very specific to what my doctor told me. It may be different from what if some of you are going to have this surgery, or if you have already had this surgery. So I'm having this surgery for Meniere's disease because I have exhausted all of the treatments out there for Meniere's, and I have tried them over and over again. So that's why we came to a decision to do this vestibular nerve section. And the surgery that I'm having, vestibular nerve section, describes it exactly, because in part of this surgery, they're going to be cutting or sectioning the vestibular nerve. And I'll explain that in a second. So the first part of the surgery, my neurosurgeon explained it to me that his job is to get the surgeons to the place where the other surgeon can take over the surgery and do the vestibular nerve section. So the first part of it is a craniotomy, and a craniotomy is where they take a piece of bone off the skull. So for me, it'll be in the back right part of my head, cutting through muscle, and then there'll be sawing through the bone and taking off my skull. And then the brain is sitting there in this protective layer. It's this kind of sac that protects the brain. The surgeon is going to be going into that sac, and inside that sac is the brain, but there's also cerebral spinal fluid. And so he's going to be cutting basically a hole into the sac, and then he'll have access to the brain. And he's going to have to maneuver into the brain in between some of the lobes of the brain, because deep in there is where the nerves are, the vestibular nerve that we're trying to get to. Once he kind of gets everything into that place where the vestibular nerve is located, then the other surgeon takes over. The other surgeon is my neuro-otologist, which a neuro-otologist is my Meniere's doctor. He's an ear, nose, and throat doctor that specializes in treating the ear. He is going to go in there and he's going to cut or section the vestibular nerve. They can't repair the hole that was created in the protective layering. That has to heal on its own. But they will be reattaching my skull with a titanium plate and screws. There's a couple parts to healing from a vestibular nerve section. The first part is healing from the craniotomy, where they take the skull off and they get into the brain area. And then the second part of healing has to do with the cutting of the nerve. The vestibular nerve is the balance nerve, and we have two of these. We have one, a balance nerve that goes to both of our ears. Now, first of all, I should say, why are we cutting the nerve? Well, basically, we're cutting the nerve because we don't want communication between the ear and the brain anymore, because my ear is telling my brain that there's vertigo. And so stopping that communication will stop me experiencing that vertigo. When we cut the nerve initially, the brain freaks out, and the brain is like, where is the information, the communication from the ear? Because the ear gives a lot of information on balance. Immediately, I will be experiencing severe vertigo that's constant and balance problems. I was basically told that I have to relearn to walk balance-wise. So my brain has to adjust and figure out how to balance again. Eventually, the brain will compensate. And that basically means that the brain will then use the information from the healthy ear to help me to relearn to walk balance-wise again. That can take a while as well. I've heard that it can take a few months, although some people have, challenges a lot longer than that. There is no set time on how long healing will be. It really just depends on my brain and if there are complications or if how things go. So my stay in the hospital is dependent on how my brain and how my body are doing. I'll spend a couple of nights in the ICU, then I will go to another floor in the hospital for the rest of my recovery, and they said that I could spend up to like a week. And then after that, I may need to have vestibular therapy. And vestibular therapy is a physical therapist who is specialized in balance, and that's all they do is treat people who have balance issues and challenges. And I already met my therapist. He is amazing, and he gave me a lot of comfort and hope and belief that no matter where I end up balance-wise after this surgery, that he's going to get me to the best place that I possibly can. I think the big thing to remember is that while May 18th is my surgery date, and while that is the beginning of everything changing for me, and it's really exciting, my road to healing is going to be long, and it'll be a big journey. And for me, it's going to be taking one day at a time. And I wanted to give you all the expectation that it's going to take a while. There are effects from this surgery that, for example, some people, about 25% of patients have a headache in the occipital part of their head, the back part of their head where the surgery is done, for more than 2 years after surgery. So there are things like that that can happen. As far as complications go, it's a brain surgery. So as my surgeon said to me, anything as very minor could happen to the most severe thing that could happen. So there's everything along the spectrum. The most common things that would be a complication in this surgery are relatively rare, but one that is less rare, I guess, is a cerebral spinal fluid leak. And that's because that protective lining of the brain that they cut into, because it's on the lower part of the brain, gravity pulls the, cerebral spinal fluid down. And so it's easy to have a leak. And my surgeon explained the 3 different things, the kind of levels of treatment from the least invasive to the most invasive of how to fix that. And the most would be going back into surgery and shunting things so that the fluid doesn't build up in my brain and cause, pressure and problems. I am going into this believing that the best is going to happen. Of course, I have fears, and that's really normal. I won't be able to be posting videos on here maybe for a while. I don't know how long. My friend Shanna is going to be posting updates for you guys. She will be posting on Instagram. It's the same handle as here. It's at Incredible Anyway. And she's going to be using my account to post updates on how I'm doing. I don't know that she'll be posting on YouTube, but if she does, it will be in the community tab. It won't be a video. Whatever you do, please do that. If you pray, pray. If you light a candle, light a candle. That would mean so much to me. The future past the morning of May 18th is very unknown. The surgeon said we don't know how long the surgery is going to be. I'm set to arrive at 5 a.m. Eastern time in the United States. Probably be in surgery about 7 a.m., 7:30. After that, everything's unknown. The surgeon says the surgery takes as long as it's going to take. He will not give my loved ones any sort of time estimate. It's going to be a journey, and I think that's basically, how it's going to be. Is it's going to take as long as it's going to take. My healing is going to take as long as it's going to take, and so everything is just unknown. While getting this port surgery was a challenge for me, it absolutely taught me lessons that I needed to know before I go into this brain surgery, and that I'm glad for, because now I will be a lot more patient with myself and just take things slow and not have expectations. I think that's the big thing, that I'm just going into this not having expectations. And frankly, that's really hard because I'd like to have some sort of idea of what things might look like in my life, but the truth is I have no clue. All I do know is that the next few months are going to be a lot of healing for me, and that's what my focus is going to be. That's going to be my priority, is healing. We'll know what we know when we know it. There's so much, that is out of my control in this, but I have been holding on to what is in my control. I picked 2 surgeons that I really trust and I think are excellent. And I'm going to just try to get my body, and that's what I've been working on. And I'll talk about this in a different video, what I've been doing, but I've been trying to get my body and my mind in a place so that I can go through this surgery in a mental place that's good. If it is before May 18th and you have had a vestibular nerve section and you'd like to share some of your own wisdom or experience that you have, you feel free to leave it in the comments. If you want to share it privately, you can direct message me on Instagram. Incredible anyway. Life is crazy right now. It's so crazy, and I'm trying to hold on, and sometimes it feels super overwhelming. I'm doing as best as I can, and that's all I can ask of myself. And I'm going to go into this and be the baddest warrior that I know that I can be. And I think sometimes being a baddest warrior means not fighting all the time. There will be times I will need to fight, but there will be times that I'll need to just rest. And I have a friend who has had multiple craniotomies because she has had many brain tumors. And so I know from her sharing with me that the healing is going to take a lot out of me, that it's going to be a lot of recuperation. I will absolutely let you know when I'm posting the last video before I go in, but you know, if it's after May 18th, you know, I'm not going to be posting anymore for a while. And I'll miss you guys. I'll miss interacting with you all. Like truly, I look for you all. Like I know you. I know your names if you're commenting frequently. I know you, and I miss people when they don't comment. And even if there are people that used to comment all the time and I haven't seen them in a year or two, and I even think about them still. So I really truly do care about you all. It's really crazy this is happening. It's one thing to talk about it, and then it's another thing that it's starting to actually become reality. Life is wild right now. I'm having brain surgery and I still don't believe it myself. Like I know it's me, but sometimes it feels like I'm talking about somebody else. I love you guys so much. Group hug. I am Kelly. Remember, you are not alone. You're not. I'm not. We're not alone. Live a life that's incredible. Anyway, I love you guys.
You are not alone in this world. You are not alone. You are not alone in this world. You are not